Welcome back to Local Sports Break, and now we come to our sports medicine tips, sponsored by Associates in Orthopedics and Sports Medicine. Tonight we have Dr. John Norman. Doctor, welcome to the show.
Thank you for having me.
All right, let's talk a little bit about something you and I were discussing off camera. There's been some issues with teams with staph infections. Tell us, everybody, a little bit of what that is and kind of what's going on with that.
Okay. Well, the staph infection is a bacterial infection. And the ones we're talking about here are really skin or skin-related infections that develop. And these seem to be more prevalent in our community. We've had several of the high school athletes who have developed these infections. And we've gotten a lot of questions at our office concerning staph infections and what can be done to prevent those and what can be done to treat them.
Well, what are you seeing as some of the causes of it?
Well, we think that one of the causes of staph infection is it affects damaged skin. So, for instance, rug burn or abrasions that kids get from sports. It's also felt to be contact with other infected individuals. Some people are carriers in their nasal cavity. Others are carriers on their skin. But being in close contact with somebody who has the infection is a risk factor as well.
And what kind of symptoms should someone look for? What would they be looking at, or how would they be feeling?
Okay. Usually what first occurs is, again, this is a skin-related thing, and most of the time it appears as a pustule, which is a central white core with usually an erythematous or red sort of area around, and then occasionally you'll see this spreading up the arm. A lot of times it's just contained within the skin, but at other times it'll actually become quite destructive to the tissues in the area and develop an abscess, which can be very painful, warm to touch, and even cause a systemic fever.
So if an athlete gets a normal cut or an abrasion from maybe it gets scraped by a cleat or gets something, and that at some point if he doesn't take care of that can turn into a staph infection?
Right. And especially if he comes into contact with someone who is a carrier or actually has an active staph infection.
So if you get a cut or an abrasion, or what should they do to help prevent that, I guess?
Well, the most important thing is hygiene, is keeping the area extremely clean. That cuts down on the bacterial count that normally lives on the skin edges. The second thing that they can do is keep those areas covered, like when they're practicing. Cover those areas up, and that sort of keeps things from the outside environment from getting in.
Now, one of the things I've always heard, it goes back to when I was in middle school and high school, a lot of linemen wear pads on their hands or on their arms, and we've always heard people talking about those pads. And talk a little bit about that and some of the risks.
Well, one of the risk factors for staph infections are sharing of arm pads, like you said. You know, a lot of times I know the offensive linemen will use it during offensive, and then they'll, as they're running off the field, they'll give that same pad to a defensive lineman. If they had a lesion or a staph infection beneath that, that would put the second player at higher risk. And also, for instance, practice jerseys, where we were putting kids for color, for scrimmaging during practice, those jerseys can actually transmit the disease.
So if you're a rec league coach or a middle school coach, and you have practice vests or jerseys, you should be washing those on a pretty routine basis.
It should be washed, and any shared equipment should be cleaned on a schedule. And any kid that has active infection should have those lesions covered during practice.
Now, if somebody feels like they've developed one, what do they need to do at that point?
Well, I mean, the first thing is early recognition. And once you see that, you probably need to get in to see either, not necessarily an orthopedic doctor, but a general medical doctor. And the treatment can be things as simple as warm compresses and topical antibiotics such as Neosporin. If they become more involved, they may even require oral antibiotics or even a surgical procedure to drain the infected tissue.
Well, we really appreciate you coming on the show tonight and talking about that. And that's something I think all the way from our high school teams down to our rec league teams, that's something that sounds like everybody, all coaches need to be aware of.
Right. And again, early recognition and prevention are the keys.
Well, thank you very much. We appreciate it.
Thank you for having me.
Stay tuned. We'll be right back.